Bonsoir, mesdames et messieurs, ladies and gentlemen, good evening. You're welcome again to another episode of the NK Podcast Show, where we educate people on how to stay young while growing old, thereby increasing your life expectancy. And with you here today, ladies and gentlemen, is Dinte Clivet Alumfi, also known as the African Pharmacist, and he is here to share with you a topic very sensitive in nature, and it affects mostly people with the cardiovascular issues. And I want to highly relate this to men. Yes, if you be man picking, take chair, sit down now. Now time for you to learn. As we dive into it now, did you know, ladies and gentlemen, that during sexual activities, during ejaculation or during orgasm, which is the peak of sexual excitement, the heart stops beating for few or milliseconds. The heart stops beating for milliseconds. Did you know that? If you did not know, ladies and gentlemen, now you know. And now I'm bringing to you this information because it is very vital for your cardiovascular health. And let us look at it in more details now. During sexual activities, what happens to the heart? During sexual activity, especially during orgasm, you know, sexual activity is like exercise, it's sports. So there is increased body temperature, of course. There is increase in there is increase in blood pressure. There is increase in heartbeat and heart rate. All these things increasing can affect you in ways that you will see in some few minutes. Another thing you must understand about issues of the cardiovascular issue is that stress, anxiety, especially when you're thinking of how will your performance in the other room look like, can affect your cardiovascular health. It can affect you and make your heart to suffer, either beating faster, increasing your blood pressure, increasing your heart rate, and all those things. And of course, your breathing turns to increase as well, body temperature increasing, which can get you to a state of hypoxia. We can get you to the state of hyperthermia. Sorry, not hypoxia, hyperthermia. And all those things are very, very dangerous to you. But yes, doesn't mean that you cannot engage in sexual activities. I would tell you. Now look at it, ladies and gentlemen. You have cardiovascular issues and you want to engage in sexual activities. Of course, you can engage in sexual activity even if you're a cardiovascular patient. You're a patient suffering from cardiovascular issues. Of course, you can engage in sexual activity, especially if you have been properly managing your disease, the symptoms of your disease. If you have been properly managing them, there is no big issue associated with you and that exercise. But if you have not been managing it properly, you might want to discuss with your healthcare provider, because it is very, very essential. We have heard of a number of people who have died during sexual activity, and when you dig further to the history, why did they die, we get to realize that some of them had underlying cardiovascular issues that they did not take into consideration. They did not follow proper treatment, and because they did not follow proper treatment, they turned to suffer the fate, which is the fatal end to their life. Now, ladies and gentlemen, what else can be done? What else can happen to you during sexual activity? During sexual activities, ladies and gentlemen, especially during orgasm, it is a peak of pleasure, it is a peak of euphoria,